Cortisol, you've probably heard it called the stress hormone, but that's only part of the story. This powerful chemical governs far more than how stressed you feel, from your sleep patterns and belly fat to your memory and immune system. Cortisol plays a central role in almost every system in your body. In this video, we'll explore the truth about cortisol, how it works, what happens when it's out of balance, and most importantly, what you can do to keep it in check. Cortisol is a steroid hormone produced by your adrenal glands, which sit atop your kidneys. It's released in response to stress and low blood glucose in small bursts. Cortisol is vital. It helps regulate metabolism, reduce inflammation, and control the sleep-wake cycle. But cortisol also prepares your body for fight or flight. When you're in danger, cortisol floods your system, raising your heart rate, increasing blood pressure, and sharpening your senses. That's helpful in the short term. The problem begins when cortisol remains high for too long. Think of cortisol as your body's natural alarm system. It helps wake you up, mobilize energy, and stay alert. It also influences how your body uses fats, proteins, and carbohydrates throughout the day. Cortisol levels naturally rise and fall. The highest point is typically in the morning, declining steadily by nightfall. This daily rhythm is crucial. Disrupted cortisol cycles due to shift work, insomnia, or chronic stress can affect everything from your digestion to your emotions. What are the signs that your cortisol is too high? Cortisol isn't the enemy. In fact, it's essential. But like any powerful tool, too much of it for too long becomes toxic. In today's fast-paced world, chronic stress is everywhere: deadlines, social pressures, financial worries, overstimulation from screens and social media. When your brain perceives stress, it signals your adrenal glands to release cortisol to keep you alert and ready. This is fine in short bursts, but when the stress never turns off, your body becomes stuck in fight or flight mode, and cortisol stays high day after day, night after night. That's when trouble starts. What happens when cortisol stays high? Imagine pouring gasoline on a fire every single day. At first, it's just a bit of extra flame, but over time, your body starts to break down silently. Gradually, here are some of the most common signs that your cortisol is running too high. Number 1. Belly fat that won't go away. High cortisol changes how your body stores fat. It encourages fat to accumulate deep in the abdomen, the so-called visceral fat. This isn't just cosmetic. It increases your risk for heart disease, type 2 diabetes, and inflammation, even with exercise and a good diet. This stubborn belly fat often stays until cortisol is brought under control. Number 2. Sleep problems. Cortisol should follow a natural rhythm: high in the morning, low at night. But when it's elevated all the time, you might struggle to fall asleep, wake up in the middle of the night, or feel wired and tired. You may lie in bed with racing thoughts, unable to switch off, and when morning comes, you feel unrested and foggy, no matter how many hours you were in bed. Number 3. Brain fog and memory issues. Cortisol directly affects your brain, especially the hippocampus, the area responsible for memory and learning. High levels of cortisol can make you forgetful, scatterbrained, and unable to concentrate. You might walk into a room and forget why, or find it hard to focus on tasks that once felt easy. Number 4. Anxiety, irritability, or depression. Cortisol interacts with your brain's chemistry. Chronic elevation can create an imbalance in neurotransmitters like serotonin and dopamine, leading to mood swings, anxiety, and even depression. You may feel emotionally unstable, tense, or constantly on edge. Small stressors feel bigger than they are. You're more reactive, less patient, more emotionally drained. Number 5. High blood pressure. Cortisol tells your body to hold on to sodium and constrict blood vessels, which increases blood pressure. This isn't always obvious. Many people don't feel symptoms, but over time, high blood pressure increases the risk of stroke, heart attack, and kidney damage. Number 6. Weakened immune system. Too much cortisol suppresses your immune response. You may find yourself catching colds more often, taking longer to recover, or struggling with low-grade infections that never fully go away. Inflammation also becomes a chronic issue. Your body is in a state of alert, but it can't fight properly when the real threats arrive. Number 7. Intense cravings for sugar and carbs. Elevated cortisol increases blood sugar levels and can make you crave quick energy in the form of sweets, baked goods, or processed snacks. You might find yourself reaching for sugary treats when you feel stressed. This isn't just emotional eating, it's hormonal. Why it matters. Most people live with elevated cortisol without even realizing it. They just assume they're aging, or burned out, or that they need to work harder and sleep less. But over time, high cortisol erodes your health from the inside out. It affects your weight, your heart, your brain, your sleep, your relationships, and your overall well-being. Understanding these signs is the first step to regaining control and taking practical action to reset your nervous system and balance your stress response. While high cortisol gets most of the attention, low cortisol can be just as disruptive and sometimes even more dangerous if left unchecked. Cortisol is often called the stress hormone, but it's also essential for survival. It helps regulate your blood pressure, energy levels, immune response, and even how your body uses fats, proteins, and carbohydrates. When your cortisol levels fall too low, your body begins to struggle with the basics of daily function. What causes low cortisol? One of the most common causes is adrenal fatigue, or more accurately, adrenal insufficiency, a condition that can occur after chronic stress has worn down your adrenal glands. Imagine this: for months or even years, your body is under constant pressure. Emotional stress, poor sleep, overworking, skipping meals. In the beginning, your adrenal glands fight back by pumping out more cortisol, but over time, they start to burn out, or production slows down, and eventually, they may fail to produce enough cortisol at all. This is when you start noticing signs. What are the common symptoms of low cortisol? Let's break down what happens when your cortisol is running too low. Number 1. Extreme fatigue. We're not talking about regular tiredness. This is the kind of exhaustion that doesn't go away with rest. You might wake up tired, feel drained throughout the day, and crash hard in the afternoon. Simple tasks feel overwhelming. Number 2. Low blood pressure and dizziness. You may feel lightheaded when standing up too quickly or experience chronic low blood pressure. This is because cortisol helps regulate your blood vessels and fluid balance. Without enough of it, circulation becomes sluggish. Number 3. Cravings for salt. Have you ever suddenly wanted something salty like potato chips or olives out of nowhere? That's your body crying out for sodium. Cortisol plays a role in retaining salt, and without it, your body starts losing sodium through urine. Salt cravings are one of the most overlooked signs of low cortisol. Number 4. Depression, anxiety, and emotional flatness. Cortisol also affects mood and brain chemistry. When levels drop to low, you might feel depressed, anxious, or emotionally flat, as if your nervous system is running on empty. You may lose interest in things you once enjoyed or feel overwhelmed by minor stressors. Number 5. Low stress tolerance. When cortisol is balanced, your body can handle stress effectively. But with low cortisol, your buffer is gone. Things that used to roll off your shoulders now feel unbearable. Small annoyances trigger disproportionate reactions. You feel raw, unprotected, and burned out. Other subtle signs include a brain fog, nausea or poor appetite, increased sensitivity to pain, difficulty recovering from illness or injury over time. These symptoms can spiral and make daily life feel like a constant uphill battle. Why it matters. Low cortisol is not just fatigue. It's a signal that your body's stress system is out of alignment. If left untreated, it can progress into more serious conditions like Addison's disease, where your adrenal glands no longer function properly, and you require lifelong hormone replacement. That's why recognizing the signs early is so important. If you suspect low cortisol, don't ignore it. The earlier you act, the easier it is to restore balance. Balancing cortisol isn't about eliminating it, it's about restoring its natural rhythm. Here are the most effective, science-backed ways to bring your cortisol back into harmony. First of all, prioritize good sleep. Sleep is the single most powerful tool to regulate cortisol levels. During deep sleep, cortisol drops, allowing your body and brain to reset. But if your sleep is short, irregular, or broken, cortisol remains elevated. Even the next day, aim for 7 to 9 hours of quality sleep each night. Stick to a consistent bedtime and wake time. Even on weekends, avoid screens at least 1 hour before bed, as blue light suppresses melatonin, which you need to fall asleep. Consider creating a wind-down ritual. Dim the lights, read a book, stretch gently, or take a warm shower to signal your body that it's time to rest. Another important thing is to practice daily stress relief. Since cortisol is your stress hormone, managing emotional stress is critical. Mindfulness meditation, even just 10 minutes a day, has been shown to lower cortisol levels. Deep breathing exercises can activate the parasympathetic nervous system, the rest and digest mode. Try box breathing. Inhale for 4 seconds, hold for 4, exhale for 4, and hold again. Gentle activities, like yoga, journaling, nature walks, or simply taking pauses during your day can all help regulate stress responses. Don't underestimate the power of social connection. Spending time with supportive people has a calming effect on the nervous system. Thirdly, don't overtrain. Exercise is a great way to lower cortisol in moderation, but too much, especially high-intensity training done too often, can have the opposite effect. Watch for signs like poor recovery, insomnia, irritability, or frequent illness. These can indicate overtraining and chronically elevated cortisol. Combine your workouts with rest days and low-impact movement, such as walking, tai chi, or swimming. Post-exercise nutrition and hydration are also essential to help your body recover and avoid additional stress on the adrenals. Fourthly, eat balanced, anti-inflammatory meals. What and when you eat can influence your cortisol curve. Start the day with a protein-rich breakfast. This helps keep blood sugar stable. Reducing stress signals. Avoid skipping meals or extreme fasting, as low blood sugar spikes cortisol. Focus on whole foods, vegetables, fruits, quality proteins, healthy fats, and complex carbohydrates. Reduce processed foods, sugar, and caffeine, which can overstimulate your system and increase cortisol production. Drinking enough water is also essential. Dehydration is a physical stressor that can raise cortisol. Fifthly, get morning sunlight and keep a routine. Cortisol follows your circadian rhythm. It naturally rises in the morning and drops at night, but this rhythm can get disrupted by artificial light, irregular schedules, or not getting enough daylight. Get sunlight exposure within the first hour of waking. This tells your brain it's daytime, helping reset your internal clock. Keep consistent routines for waking, eating, exercising, and sleeping. Your body loves rhythm, and when it knows what to expect, cortisol regulation becomes smoother. Also, it's important to consider natural supplements with medical guidance. Certain herbs and nutrients may help support cortisol balance. but they should never replace medical advice or treatment. Ashwagandha is an adaptogenic herb that supports the adrenal glands and may reduce cortisol levels in people with chronic stress. Magnesium involved in over 300 biochemical reactions, including stress response regulation. Many people are deficient. Omega-3 fatty acids, found in fish oil or algae, help reduce inflammation and buffer stress-related hormone spikes. L-theanine, rhodiola rosea, and vitamin B complex may also be beneficial. Always talk to your doctor or a qualified healthcare provider before starting any supplement, especially if you take medication or have health conditions. Balancing cortisol is a daily practice, not a one-time fix. The key is consistency. Small actions, repeated over time, make a big difference. By giving your body the sleep, fuel, and calm it needs, you can help your cortisol return to its natural flow and feel more energized, clear-minded, and resilient in the process. When to see a doctor. Sometimes, even after making all the right lifestyle changes, improving sleep, managing stress, eating better, you may still feel off. Maybe you're constantly anxious, can't lose weight, or you're always exhausted. In these cases, your symptoms might signal something more serious than just everyday stress. That's when it's time to consult a healthcare professional. Your cortisol levels might be chronically too high or too low, and both situations can point to underlying medical conditions that require more than lifestyle tweaks. If your cortisol remains elevated for long periods, your body may be suffering from a condition called Cushing's syndrome. Symptoms can include rapid weight gain, especially around the abdomen and face, a rounded, moon-shaped face, thinning skin that bruises easily, high blood pressure, muscle weakness, severe fatigue, mood changes, such as anxiety, irritability, or even depression, irregular menstrual cycles, or decreased libido. Cushing's may be caused by a tumor in the adrenal gland or pituitary gland, or by long-term use of corticosteroid medications. It's a serious condition, but with proper diagnosis and treatment, it is manageable. On the other end of the spectrum is Addison's disease, where the adrenal glands fail to produce enough cortisol. Common symptoms include chronic fatigue that doesn't improve with rest, low blood pressure and fainting spells, unexplained weight loss, darkening of the skin especially in skin folds and scars, craving for salty foods, nausea, vomiting, and abdominal pain, low blood sugar, depression or irritability. Addison's is less common, but it can become life-threatening if left untreated. It requires hormone replacement therapy and close medical supervision. If you suspect your cortisol levels are abnormal, don't try to diagnose yourself with supplements or drastic diets. Testing is simple and widely available. Saliva tests usually done at multiple times throughout the day. Blood tests, urine tests usually 24-hour urine cortisol collection. These tests help identify not just cortisol levels, but the pattern, which is essential for understanding whether your natural rhythm is off. Always consult a medical professional if your symptoms are persistent, unusual, or worsening despite healthy habits. It's time to seek medical advice. A healthcare provider can guide you toward the right tests, interpret your results in context, and help you understand whether you're dealing with a hormonal imbalance, a stress-related issue, or a more serious adrenal disorder. The takeaway: your body speaks through symptoms. Listen to it. Sometimes lifestyle changes are enough, but when they're not, medical guidance is the next best step. Cortisol is not your enemy, it's your body's messenger. When balanced, it keeps you alert, alive, and in rhythm. The key is listening to your body's clues and taking action before imbalance becomes illness. Thanks for watching. Stay curious, stay balanced.